Osteoblastomas are benign bone tumours and tend to occur between the ages of 10 and 30. They are twice as common in males than females, and the usual site for them to occur in is the vertebrae, although they also occur in the tibia, femur, humerus, pelvis and ribs. And it is the medulla part of the bone where they arise. Treatment is by surgical resection, and they are very similar to osteoid osteomas, so much so that they can be sometimes difficult to distinguish from each other. Here is a summary of the differences. Osteoid osteomas tend to arise in the femur and humerus, whereas osteoblastomas tend to arise in the vertebrae, and osteoid osteomas arise in the cortex, whereas osteoblastomas arise in the medulla. A key difference is that osteoid osteomas are smaller than osteoblastomas usually, and they have a thick rim of sclerotic bone, whereas osteoblastomas have a thin rim of sclerotic bone surrounding them. Clinically, osteoid osteomas may present with intense pain that responds to aspirin, whereas osteoblastomas are associated with dull pain that doesn't respond to aspirin. The intense pain in osteoid osteomas tends to be worse at night. This is the radiological appearance of an osteoblastoma arising in a vertebra. Grossly, osteoblastomas are over 2 centimeters across, usually around 4 centimeters, and they have a hemorrhagic, gritty cut surface. Histologically, they are well circumscribed with anastomosing trabeculae of woven bone surrounded by osteoblasts. This is the low power histology of an osteoblastoma, and on a higher power you can see trabeculae of woven bone surrounded by osteoblasts. On the higher power you can see that the tissue is quite vascular, and amongst the osteoblasts are multinucleate giant cells, and these are osteoclasts.